Good evening, everyone. This is Irene Sebastian, and I am going to report about the health problems of school children. Number one is the respiratory syncytial virus. It is the most common infections of the lungs and respiratory tract, and it is so common that most children have been infected with the virus by the age of 2. And talking about causes, respiratory syncytial virus enters the body through the eyes, nose, or mouth. It spreads easily through the air uninfected respiratory droplets, and a child or anyone can become infected if someone with RSV coughs or sneezes near you. The virus also passes to others through direct contact such as shaking hands. We also have here the symptoms of RSV or respiratory syncytial virus: the runny nose, dry cough, low-grade fever, sore throat, sneezing, and headache. As you observe sa symptoms and causes, more siya sa COVID-19 no. Actually, RSV and coronavirus disease 2019 or the COVID-19 are both types of respiratory viruses, and some symptoms of RSV and COVID-19 can be similar. Ang RSV can cause severe infection in some people just like COVID-19, including babies 12 months and younger than that, especially premature infants or older adults. Also to those people with heart and lung disease or anyone with a weak immune system. So we need to take care of ourselves, mag-take ta og mga vitamins, eat more immune building food. No? So kana sila is para raman Japon na sa atoang kaayuhan. Now, let's proceed on how to prevent this kind of virus. It was stated that there is no vaccine exists for respiratory syncytial virus, but these lifestyle habits can help prevent the spread of this infection. Number one is to wash your hands frequently. It is a way in protecting against many different types of infections. Teach your children the importance of hand washing, especially kana ganing magdula-dula ang mga bata then padulong sila mukaon. While washing your hands, dapat naapod ang sabon para ma-sure nato nga limpyo, then if naay alcohol, mas maayo. I remember during our elementary days, ginatudloan taon how or what are the proper ways of washing hands. Number two is to avoid exposure. Cover your mouth and nose when you cough or sneeze. Limit your contact with people who have fevers or colds. Diba sa situation na gani nato karon, we are wearing a face mask para iwas makahawa o mahawaan ta, and we also applying social distancing which aims to prevent sick people from coming in close contact with healthy people in order to reduce opportunities for disease transmission. Number three is to keep things clean. Make sure kitchen and bathroom countertops, doorknobs, and handles are clean. Discard used tissues right away. Actually, dili lang sa katong na-mention ang dapat hinlo. Mas maayo if ang palibot sa panimalay, limpyo, and of course, ang ato ang lawas. Health is equal to wealth, and a house which is clean represents the good health of people staying in. Also, in school, classroom should be clean para kampante sad ang mga parents na safe ang ilahang anak pag maato sa eskwelahan. Number 4 is don't share drinking glasses with others. Use your own glass or disposable cups when you or someone else is sick. Label each person's cups kung kinahanglan. And if ever naatay mga lakaw or students moadto sa school, dapat na-adjoy mga kanya-kanya nga tumbler, mineral, or anything na pwede butngan sa alimngon para iwas nga matakdan ta og sakit sa lain and namanggoy mga sakit nga kanang makahawa by the saliva. Number 5 is don't smoke. Babies who are exposed to tobacco smoke have a higher risk of getting RSV and potentially more severe symptoms. If you do smoke, never do so inside the house, car, and school. And ginabawal jud baya sa school ang manigarilyo and other places like church, hospital, and etc. And dili pod tanan tao nga kanang makasimot gani sa aso sa sigarilyo is okay lang, na uban kay kanang murag maglisid sila og ginhawa. Sa akong pagkabaluhan na mga inana mo, to those individual nga ga-smoke, they should find a place wherein walay tao, especially baby. Number 6 is wash your toys regularly. Do this especially when your child or playmate is sick. Pareha ganina sa akong giingon, dapat limpyo kanunay kay ang mga bakterya dili nato sila makita. Maong, mas maayo nga maglikay na lang ta nga na ay masakit. Basta always remember nga mag-sanitize. Next is the ear infection are common in small children and often resolve on their own within a week or two. They can cause earache and temporary hearing loss. Middle and out ear infections are common in children. Ear infection is caused by a bacterium or virus in the middle ear. Ang kana akong ginamention nga middle ear is kana ganing na ay kanang baga nga araw, so dira siya nga part. This infection often results from another illness called flu or allergy that causes congestion and swelling of the nasal passages, throat, and eustachian tubes. Okay, talking about the infection, kita mga Pinoy, I don't know if naamoy kailang inani but kana ganing tao nga ginatusok nila ilang dalunggan gamit ang kuko kay kunwari, gilok daw, inana, but ang kukubaya is maka-infection, then what if gagunit kag bisan unsa dira tapos wala man lang ka ng hugas, do you think wala siya effects? Of course na, matingala na lang ka nga, kanang gasakit na imong dalunggan, tapos na-infection na di ay maong dapat aware jud ta sa atong mga actions. We have here some of the symptoms of ear infection: the ear pain, trouble sleeping, trouble hearing or responding to sounds, loss of balance, drainage of fluid from the ear, and headache. So, these symptoms may be na-experience or nakabati ta ginani, no? And maingon ra ta nga wala ra ni oy inani good, pasagdaan na nato wala ta or mo kabalo nga na ear infection na di ay pag makapansin ta nga murag na adjure something wrong, or as a guardian kapansin ka nga murag na adjure mali sa bata, then consult a doctor. Wala may mawala guro kung magpa-check up. Basin sa kapabayaan, nag-lead na noon siya into a serious complications like the impaired hearing, speech or development delays, spread of infection, and tearing of the eardrum. Next is the gastroenteritis or enteritis. It is a bowel infection that causes inflammation of the stomach and intestines. It leads to diarrhea and sometimes vomiting. Ang vomiting is kanang pagsusuka. The vomiting may stop quickly, but the diarrhea can last for up to 10 days. Gastroenteritis or enteritis can be caused by many different germs, although the most common cause is a viral or bacterial infections. Maong kita dapat magamping ta sa atong ginakaon o ginainom. Usahay na atay batasan samot na kanang sa mga bata nga kanang naay natagak nga pagkaon. Nga good niya, kanang maingon data nga saya nga ani, oy pwede pa ni kay pa ni 1 minute din puniton, tapos kaunon pag ulit to aragi sakitan na og tiyan, tapos kana pong usahay di ba kanang pukaon ta og junk foods naman ay mga mamilit sa atong kamot, atuan ng tilap-tilapan, feel na feel pa kay nato, tapos wa ta kabalo hugaw dito atong kamot. We also have here the symptoms. First is the nausea, headaches, vomiting in first 24 to 48 hours, no appetite, stomach pains, and fever. And to prevent gastroenteritis or enteritis, it's important to wash your hands before handling food and iwasan sa nato nga kanang magpataka lang taog kaon-kaon mga salin-salin, okay? Then, the last one is the roseola. It is a viral infection that usually occurs in babies and children between 6 months and 2 years old. It causes a high fever or napagani uban kanang convulsion good ang bata. We have here the symptoms: mild sore throat, sudden high fever, swollen neck glands, rash of pink raised spots on their chest, tummy and back, mild diarrhea, decreased appetite, and swollen eyelids. Kanang kabantay mo kanang sabungang singot good sa mga bata, di ba na imanggaw sa anak pula-pula, murag gagmay sa lawas sa bata. So, mura po siya na inana sa roseola. Ang kaso lang, kanya siya is maka-experience ka og high fever or kataong giingon ganina nga makonvulsion ang bata. Then, pag weak pa dyan ang imong immune system, no, tapos nagka-roseola ka, pwede nga maka-experience ka og mga serious complications from the infection such as the pneumonia or encephalitis, a potentially life-threatening inflammation of the brain. Because there's no vaccine to prevent roseola, the best you or we can do to prevent the spread of this kind of infection is to avoid exposing to an infected one. If you're sick with roseola, just stay at home and away from others until the fever has broken. That's the end of my report. Again, this is Irene Sebastian, and Miss Shabok will continue the other health problems of school children. Good night and God bless.